The question is really what's driving the inflammation that's causing the high blood pressure? You know, there's other reasons that sometimes people just don't do well with very high protein diets. So what can I do to help these people out? During this season, there's a lot we need to do to be careful.
Welcome to our Q&A highlights. Q&A sessions are recorded every month, and our enhanced members get an exclusive opportunity to ask questions from one of cellular medicine's brightest minds, Dr. Elizabeth Yurth. Get a chance to ask your questions by becoming our enhanced member at bli.academy/memberships. You also get access to our content library full of tips, articles, videos, lectures, previous live Q&A sessions, and more.
How can you turn down the body's inflammation in somebody who has high blood pressure? So let's challenge this framing of this question first, because you're asking about turning down inflammation in somebody with high blood pressure. But the question is really what's driving the inflammation that's causing the high blood pressure, which is elevated vascular resistance and cardiovascular disease. High blood pressure gets so ignored. But when your blood pressure starts climbing above 115/70, it means there's increasing vascular dysfunction. We don't really get concerned until it's over 120/80, but I can tell you anything above 115/70 is likely that we're starting to see some elevated vascular resistance and some oxidative stress to the lining of the blood vessels. So the key is that we have inflammatory changes in the blood vessels creating the hypertension. So we need to focus on how do we lower that chronic inflammation that's creating this dysfunction in the blood vessels. So we know that there's this lining in the blood vessels called the glycocalyx, right? And that we lose that protective level. We also know that we get oxidative stress and mitochondrial dysfunction, which is going to reduce nitric oxide availability. And then these immune cells infiltrate. And then we get arterial stiffening, sympathetic nervous system disruption. Always go back to why is all this starting? Is it because this patient actually has insulin resistance, even if it's at a low level? I always look at visceral adiposity, because even if somebody does not have insulin resistance and they look thin and fit, if they have visceral adiposity, a waist to hip ratio in women greater than 0.9 and men greater than 1, then they are at increased risk for vascular dysfunction, independent of anything else, because it means they're collecting fat around their midsection, which is a dangerous spot. One of your warning signs of vascular dysfunction. So always look at those things first, and then think about, if you can't figure out a cause there, the metabolic system looks great, go to your gut, because gut-derived inflammation is going to drive vascular inflammation. So lipopolysaccharides, when the gut's leaky, lipopolysaccharides get out of the gut and they create vascular changes. They create dysfunction in the blood vessels. SIBO, intestinal permeability changes, all will lead to vascular changes and high blood pressure. Or chronic infections. How about chronic periodontal disease or chronic viral infections? Look at heavy metals. Look at nutrient deficiencies. Is there magnesium deficiency? Is there omega-3? Is there vitamin K2? So I think the key here is there is something creating this inflammatory response that's creating the hypertension. You've got to be the sleuth that finds it. And that sometimes means looking at toxins. It definitely means looking at gut. But always start with the most likely culprit, a metabolic dysfunction. And then, really have them work on an anti-inflammatory diet, high polyphenols, lots of omega-3s, right? Get rid of the seed oils, because that's a huge problem. So if they're eating processed foods with seed oils, if they're eating out a lot even, seed oils are hard to get away from if you eat at a restaurant. Eating nitric oxide-rich foods like beets. So, high-dose EPAs, DPAs, magnesium, vitamin K2, all really critical here. You can't just sit there and let the blood pressure be high while we're trying to figure out what's causing it to be high. So you do have to treat the blood pressure while you're looking at what is the cause of the hypertension. And maybe you won't find the cause. In that case, my go-to drug is what's called telmisartan. And the reason I like telmisartan so much, it's what's called an angiotensin receptor blocker. And it actually has significant data supporting some longevity effects, some anti-cancer effects, increases what's called PPAR gamma, so it actually can improve endurance training. So there's actually some really good advantages of this drug beyond its blood pressure control. If the blood pressure is high and I treat above 120/80, then I start them a drug while I'm searching down these other things, while I'm correcting the diet, while I'm looking for the problem. And then maybe you can get rid of the blood pressure medication after that. How can one maintain and develop muscle when on a very low protein diet? So she, or somebody she knows, has acute chronic kidney disease. So she's slender, but unfortunately lost a kidney for some reason and now has one kidney and it's not functioning great. So she has 20% of normal, what we call glomerular filtration rate. And so we advise people with low kidney function to take in a lower protein diet, because protein is a little bit of a stressor to the kidneys. So she's only eating 30 grams of protein a day. Put that in perspective, she's a small, slender female. She still probably needs at least 80 to 100 grams if we're really talking about building muscle. So what can you do with somebody like this? And I think there's other people who fall into this category, right? They struggle with eating enough protein. So what can we do to kind of help these people along? So this is beyond even the people with chronic kidney disease. There's other reasons that sometimes people just don't do well with very high protein diets. So what can I do to help these people out? Or the people who do have chronic kidney disease where we do have to lessen it. Number one, 30 grams sounds really low to me. I do wonder if that's an overly cautious number. I think most of the time we recommend about 50 grams a day, even with somebody with low kidney function. So you might follow and see, can you push that up a little bit without affecting creatinine, without affecting GFR further? But if not, then here's my go-tos. And these guys, take heed. You're tuning out. You're like, oh, I don't have kidney dysfunction. I eat a lot of protein. Here's just some other things that will help you with muscle building. So one of the things, and you guys have heard me talk about it, is fortetropin. So fortetropin is found in a product called Myos MD, and it's fertilized egg yolk extract. The way it works is by inhibiting myostatin. Remember, myostatin, muscle, stop, myostat, turns off muscle growth. So it essentially removes the brakes on muscle development. So we can actually form more muscle with less exercise. And the studies have shown that just 2 grams a day, even in caloric restriction, and even when people weren't exercising at a high level, maintained lean muscle. We also think that fortetropin, besides turning off myostatin, actually has some growth factor signaling, so it increases IGF levels. Really easy thing to do is add it. It comes in a powder form. I add it to my protein shake, but in your case, you could just add it to a juice. You can add it to something else so you can get this extra fortetropin in. That's going to help considerably, about 2 grams a day. Make sure your hormones are optimized. You absolutely have to have enough testosterone, estrogen, growth hormone, or IGF, on board, and progesterone to build muscle. So make sure those are optimized. And I don't mean just like they're barely okay. You need to be on the higher ends for some of these things because you need a little more testosterone on board, right? You may need your estrogens a little higher. We may need to hold your IGF at a little higher levels because those are all things that can actually help the kidneys with function and help you still with muscle building. Make sure thyroid's optimized as well, almost a given, but remember hypothyroidism is a big accelerator of loss of muscle mass. And many chronic kidney disease patients do develop subclinical hypothyroidism. So don't forget that. Target really optimal ranges. Get that free T3 up into the 3.5 kind of range. What else? Essential amino acids that we know are helpful for muscle building if you can't take in a full protein load. So the primary amino acid that we know is responsible for enhancing muscle function is leucine. So leucine is the primary mTOR activator. Remember, mTOR is our growth. So you can do just leucine, like 3 to 4 grams, timed around training or meals, and that's kind of a master switch for anabolism. So it sort of turns on the anabolic process. I also love what's called HMB, which you can find these products pretty easily. So HMB is beta-hydroxy beta-methylbutyrate. It's a metabolite of leucine, so you can use it with leucine or instead of leucine, but it actually prevents muscle breakdown. Usually about 3 grams, kind of divided dose. It's really not as anabolic as it is anti-catabolic. So usually I like to use those two together, a little leucine and a little HMB. Just taking a complete, not branched chain amino acids, essential amino acid formula. Because that's going to provide some of the building block amino acids without the nitrogen burden of massive amounts of protein. Add those things in and then keep resistance training. And if you're having trouble with resistance training because your muscle bulk is not as good and you keep getting injuries or things like that, do things like add blood flow restriction. I have a really injured shoulder. And one of the things I've done is added blood flow restriction training so I can lift less weight and still get the same impact on my muscles. A brand called Saga, easy, they hook to your phone. And when you do blood flow restriction, you allow significantly more muscle building at a lower load. At 20 or 30% of a normal training load, you can get the same benefits. So that's a really nice thing to do if we're trying to build muscle on you, but we don't want to overload or overly stress your system. Don't forget things like taurine can be helpful, urolithin A can be helpful, carnitine can be helpful, but I think that those are things that I mentioned are going to be your go-tos. Your essential amino acids, a little leucine and HMB, resistance training with BFR bands to help you out a little bit, and then the fortetropin. That should get you a long way. Rosalind's from California. She asks about hair loss. She said, I used to have an abundance of hair, but a few months ago, my hair started falling out a lot, mostly on one side and in the back. She takes a lot of supplements. She takes plasmalogen. She eats healthy. She said it's not cancer, but it's still devastating. Any suggestions? So this is a huge problem, Rosalind, and I think there's a lot of women out there who can sympathize. I have never, ever seen so much hair loss in my practice, myself included, as I have in the past 5 years. It is astounding. And nobody really has a good handle of why we're seeing this, but it is across the board more than just there's something, right? Might it be COVID? We don't know. Is there some kind of new environmental toxin we're being exposed to? I don't know. But when you see somebody like you, what you're describing, where it's not just all over hair loss, but patchy hair loss, that's more likely autoimmune. So when you're seeing patchy hair loss, it's more likely an immune problem that you have to kind of get to the bottom of, right? Is there some inflammatory issue that's affecting blood vessels? The hair follicles are really critical markers of vascular dysfunction. So if there's vascular dysfunction because there's an autoimmune disorder, then you start to lose hair. Also remember that telogen effluvium is this asymmetric pattern that's unusual but also possible. That's just sort of a stress-related hair loss, right? So usually that's going to be much more all over, but it can be more patchy as well. I think critical question is what happened 3 to 4 months before. Did you get a COVID vaccine? Did you get COVID? Did you have a major stressor or illness? Did you change a medication? Did you have a lot of weight loss? Did you stop eating as much protein? Was there a hormonal change? Something like that. So you always want to look at those things. Remember that the hair loss will happen about 3 to 4 months after the major stressor, because that's the hair cycle. So you have to kind of look back in time, not right at the time when the event happened. If you look at things that you really have to go back and optimize, thyroid, so really free T3 has to be at a good level, above 3 at least for hair. You have to make sure that you have estradiol balanced with testosterone and progesterone. If you get out of balance with those hormones, then you'll start seeing hair loss. You have to look at cortisol because chronic stress can trigger hair loss, and that's because of cortisol dysregulation. So you can do a 4-point cortisol test to figure out what cortisol is. The number one and maybe most neglected cause of hair loss is low ferritin. So that can be because your body was stressed and started utilizing iron more, or it can be because you had bleeding from something. If you have heavy menses, that's one cause. You have to always worry if you see low ferritin, is there a slow GI bleed, something like that. Chronic disease can lower ferritin. Is the number one nutritional cause of hair loss. And it needs to be actually around 70, at least above 65 for hair growth. So if your ferritin is below 65, you will actually start losing hair. I saw one of my daughters, her ferritin levels were down to like 12. She was losing her hair, so we have to really keep up with replenishing that. Zinc is also really essential for hair follicle growth, so I would say make sure that you're measuring your micronutrients and knowing what's going on there, including your ferritin, including your zinc, your B vitamins, essential fatty acids. Look at your protein intake. If you're not consuming enough protein and you're working out, protein will prioritize going to muscles over your hair. So you may have great muscles, but lose hair loss. And again, you got to go back to autoimmune, check ANA, check thyroid antibodies, check inflammatory markers. Is there something autoimmune that we need to go in after here? When that fails, look at toxins. Mercury, lead, arsenic. Arsenic's a big cause of hair loss. I just saw a patient who had horribly high arsenic levels, and it's because she drinks this really healthy root tea all the time. Some of the green teas are very heavy in arsenic. Arsenic can really collect in the hair follicle, so you can send a hair follicle sample for heavy metals and look at that as well. And then look at gut health, because gut is a really big player. And dysbiosis in and of itself can trigger hair loss. Lots of things to look at here and not just accept. Your pattern sounds autoimmune to me, but look at the other things first, and then you can start going down the autoimmune pathway. Thyroid alpha 1 might be an answer there. As far as what you can do right now, if the ferritin's low, replenish it, make sure the nutrients are replenished. Collagen peptides, 15, 20 grams a day, we know is helpful for hair. Make sure that you're getting the protein, and then consider you could add a little biotin, a little MSM. You can use GHK copper topical, so we formulate that, so you can put it microneedle into the scalp. Rosemary oil has some really good evidence to support hair growth. So those are things you could kind of do right now to sort of help with that. What are my favorite go-to peptides and or supplements for immune support during the sick season? So we're kind of getting into that. I just talked to my 18-year-old at college, and he said, everybody's sick. During this season, there's a lot we need to do to be careful, especially if you're like me and you're traveling a lot, because airplanes and airports are horrible. So number one, peptides, you really can't beat thymosin alpha 1 as an immune support. It is the gold standard for immune optimization. So what I recommend is during this kind of season, as we're getting into the fall right now, where everybody's moving inside more and we're going to see more illness, doing a little course, like a 6-8 week course of thymosin alpha 1, a 2 to 3 times a week dosing. But particularly if you're going to travel or you're going to a concert, you're going to be around a big crowd, then use it for a day before, the day of, the day after. Because what thymosin alpha 1 does is it stimulates our immune system in exactly the way it should have when we were young. It is what worked when we were young, so we didn't get sick. And now as we're getting older, we get sick more often and sicker. So basically it's directly stimulating the T cells to function, to differentiate, to modulate the cytokines, working at the root level. So thymosin alpha 1, always my go-to. If it's tough for you to get, then what supplements can we use here? All of you guys know vitamin D3. Always want to make sure you're at an optimal vitamin D3 level, which in my mind is between 60 and 100. So make sure you test your vitamin D levels and know that if you have low levels, you're much more likely to get sick and much more likely to get really sick from that illness. During COVID, that the sickest people all had low vitamin D levels. So I like to have people pulsing at a higher levels, even going up to 20,000 IUs kind of off and on a couple of days a week if they're going to be exposed to a lot of sick people, like it's Thanksgiving or you're traveling. Or if you get sick, going up to 20,000 or even 50,000 for a couple of days. But otherwise, taking a regular dose of 10,000 IUs of D3 with K2 and making sure that you have optimal levels to test your levels. Zinc is great. You know, people kind of know about it, but forget about it. And you can use it either when you get sick or kind of preventively. So about 25 milligrams, 15 to 30 milligrams a day. You might want to take a little GHK copper cream with it to keep that balance there. If you get acutely sick, then going up even higher, like 50 milligrams a couple of times a day for a couple of days, like 3 to 5 days. The best are either zinc acetate or zinc gluconate. I like lozenges that you can suck on. I think they're easily absorbed. They have maximum effect on sort of the throat mucosa where you're going to be breathing in some of these things, and they're easy to do. You can also add a little quercetin with zinc because quercetin facilitates zinc getting into the cells. You can pair it with like 500 milligrams twice a day of quercetin if you're going to be going traveling, and that's going to be helpful too. I'm a big fan that everybody needs NAC. That's our precursor to glutathione. It's one of our major detoxification processes, pathway enhancers. It really is valuable for preventing illness or helping you if you get sick because it actually breaks up mucus. You're supporting glutathione synthesis, which is your primary cellular antioxidant symptom, but because you're breaking up this mucus, you're going to reduce the ability of the virus to kind of replicate. So this mucolytic process that NAC has can be really helpful here as well. At least 600 milligrams 2 times a day, going up to 1,200 milligrams 2 or 3 times a day if you're sick or traveling. High-dose vitamin C, I think, can be really useful too. Doing 1,000 milligrams a couple times a day. Remember, sometimes it can cause diarrhea, so be careful with that. So make sure you use a liposomal form. That's going to work better. And I want to tell you guys about kind of a new product that is just kind of making it to the US from Australia. I think it's on the OHP Health site now, called AEVUM, AEVUM Rejuvenate Pro. And this is a very cool product because it contains something called IDP, immune defense peptides. We've heard a lot about lactoferrin and colostrum, but really the working part of lactoferrin, which is what's in colostrum that's really helpful, is these immune defense proteins. And those actually are the best piece of immune modulation. So they're very cool and very important. And they mix that with a little rosemary, what's called carnosanic acid, that's a potent antioxidant that protects the cells from oxidative stress, and a little kawakawa, which is this native New Zealand plant that modulates cytokines and chemokines and is a really good immune modulator. So this is a really nice thing to take. I can tell you I've had a couple patients who have really low white counts. A patient with cancer who really had trouble with her immune system. It brought the white counts to normal. She's been completely stable, and I struggled to keep her white counts above 2. It's completely normal with this product. So it's actually really nice. And then another thing I like that you can get off the OHP site is something called Viracid. And Viracid contains some of my favorite ingredients as antivirals, which is monolaurin and leucine. It also has a little bit of zinc, a little bit of vitamin C. So now you can get all those things we talked about in one little capsule. So you can keep the Viracid on hand. I think everybody should just have this on hand. Take it before you travel. Take more of it if you get sick. It's kind of immune support, immediately 1 to 2 capsules every hour. So if you're starting to get sick, you do a lot. But preventatively, you can just do a couple of caps a day if you're going to be traveling or things like that. And the last, I'm hitting this hard because I think right now is a really important time, and we are going to be getting back into people getting COVID again and all this stuff that we're terrified about. And that's zeolites. Those of you guys who don't know what zeolites are, but they're basically when volcanic ash hits water, it makes this very cool little cage-like structure. But there's a lot of studies on zeolites and viral particles. And they actually looked at SARS-CoV-2 and they found that it completely actually denatured the virus. The virus could not conglomerate into a full virus, into full viral mechanism. It's been tested in hepatitis viruses, influenza viruses, herpes viruses, adenoviruses. I like what's called natural cellular defense, or NCD. It's a little drop, so it's easy. You can keep in your pocket or your purse, 15 drops 3 times a day when you're traveling. Really nice antivirals. I promise you, if you do this approach of having good vitamin D, maybe doing a little zeolites, keeping the virus on hand, probably will not get sick. What do you think of combining peptides together in a syringe? I thought you said not to do this. Don't do that. I'll end on that. All right, guys. Thank you so much. We had a lot more questions there. We'll hit them the next time. I appreciate you guys getting the questions too, man. Sorry we didn't get to them all, but I think we covered a lot of really important topics. This is the last Q&A of 2025 because I am traveling to lecture. I have to go to London in November. We have 3 conferences in a row. My time over the end of the year here has gotten pretty cramped. So we will see you in January, but we'll keep posting things. Always feel free to reach out. I will keep doing things on YouTube and Instagram. So follow me at Dr. Yurth on YouTube and Instagram. Tell your friends about that. I'll post a lot of this information. I'll try and answer some of these questions on YouTube or Instagram since I know you guys like them. I hope you guys learned some things. Continue to be a part of this academy and continue to help it grow. I think it's so important that we get education out there in a sensible fashion, not just teaching the cool new shining object, but teaching the science. Please reach out with any questions. You can always send an email to us, anything that will help. My amazing client care coordinators are always here to help too. And we're always happy to see new patients. We can see people in almost every state. BoulderLongevityInstitute.com. Thank you guys. Appreciate you. Enjoy the holidays with your family, with your friends. Relax. Try and enjoy life.